I run a company named Save a Life First Aid Training Institute. I'm also associated with all government institutes like First Indian Red Cross Society, St. John Ambulance, and I've been conducting this training as a freelancer and with government institute for last 18 years. I have provided training for most of the MNCs now, I guess, in Mumbai and Pune, like JP Morgan, DHL Logistics, PNG, Amazon, Flipkart. Um, I am associated with 70 schools in Mumbai, Pune, and Gujarat to provide training and prepare them for first aid for the teachers, parents, and the nurses. I'm also associated with different hospitals for their emergency management, like Kokilaben, Ajmera Institute of Health Sciences. So that's a lot of work that I'm doing from last 18 years to create a lot of awareness. I do awareness sessions at societies and MNCs, and we do a full-fledged training of 8 hours training of first aid and CPR, where we deal with different kind of medical and surgical emergencies, which you can always join if you are interested. That's all about me. And I have my practice in Mumbai, and I do private practice also. So let us start because this is a very important session that you have been introduced to, and it is the call of the time. I feel now because we have seen a lot of cardiac arrest situations around us, but we are not aware what to do and how to help the patient. And they've only heard, and we feel what we could have done better for the patient, right? Um,
Need some help?
Yeah. So I would like to tell you what is CPR first, and then we will begin the session, or then I'll share my presentation with you.
Okay.
So what is CPR according to you? Because we all have seen CPR. Uh, you all know what is CPR, kind of cardiopulmonary resuscitation, where C is cardio is heart, pulmonary is lung, and resuscitation is to continue the work of a heart and a lung. Is called as CPR in short. Okay, we all have seen giving compressions and breathing in only in Bollywood movies. We have not actually given CPR to anybody. So we actually don't know when to give CPR, how to give CPR, what should we expect when we give CPR to a patient. Okay. So whom will you give CPR? Is it so CPR you give only in one condition, that is cardiac arrest. Okay. CPR you give only to one in one condition, that is cardiac arrest. So you have heard two terms, that is heart attack and cardiac arrest. So these two terms though look similar related to heart, but they are different. Okay. What happens in heart attack is your heart is beating, it is pumping blood to the entire heart, but it has got its own blood supply. Any one blood supply stops, but the remaining heart is beating. Patient will be able to talk to you. Patient will complain that I've got chest pain, I'm not feeling that great, I'm feeling nauseating, I'm perspiring a lot, I'm feeling the pain. You will see the patient is becoming very restless. You think probably the patient is having a heart attack, and you take him or shift him to the nearest hospital. Whereas in cardiac arrest, what happens? Your heart is beating and it stops suddenly. It doesn't give you time. Patient will not complain you anything. So in heart attack, patient was complaining you, right? That I've got chest pain, I've got this. But in cardiac arrest, patient is not able to complain. Patient doesn't complain. If he complains, we would probably take him to the hospital. But in this case, what happens? Surprisingly, the patient has no complaints. So you have heard about little situations around you. He slept last night, he didn't get up. So he was all good. Today evening when I met him, he was all good. And then the news came next morning that he's no more. I'm surprised, how can it happen? Or he was on a very healthy diet. He used to do very good exercises, and still what happened suddenly? Or people going to gym, or if you're seeing a lot of Bollywood actors or actresses around us, we are seeing sudden deaths. This sudden death or sudden stopping of the heart is called as cardiac arrest. Who can go into cardiac arrest? So can there be any pre-existing illness? Not necessary. So anybody at any moment of time can go into cardiac arrest. Right from newborn baby till the person dies, he can go into cardiac arrest. So then there is no age criteria. So sometimes people say, no, madam, we don't have anybody who has got a heart problem or diabetes in my house. So why should I learn about CPR? I am not needed. I don't need it. I'm very fit. So you don't know when you would need a CPR to save a life of the other person. Okay. So learning CPR for people who are not a doctor or who are not from the medical profession, that is doctor or nurse, is very, very important, because by the time you reach to the doctor, it is generally very, very late. And you have heard that sentences in movies, in your personal life. If you would have reached early, we could have saved life. You said, ma'am, he just collapsed and I ran and I came to you and you saying you should have come early. But he had no complaint. Why would I come early? Right? So what happens? That's a dilemma of this situation, that the patient is not having any complaint. Whereas in heart attack, patient will always complain. So if I tell you in short about the difference between heart attack and cardiac arrest, in heart attack, patient is conscious, patient whereas in cardiac arrest, patient is not conscious. In heart attack, patient can talk to you, patient can complain to you, whereas in cardiac arrest, because he's unconscious, is not complaining. In heart attack, patient is breathing, patient pulse is there, whereas in cardiac arrest, there's no breathing, no pulse is there. Okay, so that's a very, very vital difference. So people feel whether I should go ahead and give CPR, whether I should do it or not do it. So it's just simple thing, no response, no breathing means patient is in cardiac arrest. Okay, so now I share my PPT for you to know how to recognize a person that is unresponsive, how to know that the patient is in cardiac arrest. Just give me a second. Can you all see my PPT?
Not yet. Not yet.
You cannot see?
Right now, I can't see. Are you sharing it? Can you press share?
Yeah,
Yeah.
I have pressed share. Yeah.
Okay.
See now?
No. Yeah. Yeah. I can see it now. Yeah.
Okay. So this is what I was trying to tell you. What is CPR is nothing but a life-saving technique which has to be learned by a people who are not from a medical profession. Medical professional knows it, but by the time we reach to the doctor, generally it is very, very late. Okay. So that is why it is very mandatory. It is very important for you to learn about CPR. Okay. How will you recognize that the person is in cardiac arrest? Okay, because as I said, CPR has to be given only in one condition, that is cardiac arrest. You need not know the entire medicine or you don't need not be doctor. You have to identify only one condition, that is cardiac arrest. How would you know that the patient is in cardiac arrest? Only two things, that is no response and no breathing. Okay, we'll be seeing how to recognize. So once you've checked that the patient, so you have to check for responsiveness. So how do you check for responsiveness? So no Indian technique of checking for response, patting on the back, or sprinkling water, pressing ears, eyes, pinching the ears, pinching the skin. No need of that. Simply you have to talk to the patient. So try first calling patient. Hello, hello, sir. Are you okay? Are you okay? If he is not responding, then you kneel down next to the patient and you tap on both the shoulders. You tap on both. That's the simplest way. How long will you tap? So every step has got its time limit. And how much time do you have to save someone's life? Is only 4 minutes. That is why by the time you reach to a doctor or to a hospital, doctor or a hospital always says, if you would have come early, we could have saved life. Okay, so what is the time to save somebody's life? From the time they collapse is only 4 minutes. Why 4 minutes? Because your brain survives on only two things, that is oxygen and glucose. More than 4 minutes, if your brain is not getting oxygen and glucose, patient collapse. Okay, and moment you see patient collapsing, you should immediately begin with the steps of CPR. Okay, so how will you identify whom to give CPR? Whenever the patient is in cardiac arrest. How will you identify that the patient is in cardiac arrest? You have to check for response and you have to check for breathing. You are not going to check for pulse like we see in movies. You are going to check only two things, response and breathing. No response, no breathing means patient is in cardiac arrest. Okay, so I'll be demonstrating you all these steps. I know it looks very, how to do that. Speaking is easy, but learning is little difficult. So when I demonstrate you, it will become more easier for you. Okay. So once you've checked this, once you've confirmed that the patient is in cardiac arrest, that is no response, no breathing, you immediately move to the next step, that is checking for breathing. Okay. How do you check for breathing? To look at the chest. So initially we used to feel for the warm air from the nose, look at, put our ears on the chest and try to hear the breath sound. Now we no longer practice that. We now look at the chest rise and fall. Okay. Now we look at the chest rise and fall. So how much time should I check for response? How much time should I check for breathing? Is only 5 to 10 seconds, because you have only 4 minutes to save someone's life. So every step is only 5 to 10 seconds. How do I know 5 to 10 seconds are over? When I tap on the shoulders for twice, hello, hello, sir, are you okay? Are you okay? 10 seconds are over. That is how you're checking for response. What kind of response are you expecting? He might make some noise. You might see any movement in the limb. You might see pinching of the eyes or ears. If you see any of these reaction or any movement of the body part, even if a flickering of eye is, patient is conscious, patient is not unresponsive or non-conscious. So patient is conscious. But if you don't see any of these things, no response, no movement, no voice command, no response to voice command, or no voice output from the patient, then you should know that the patient is not responding. Immediately move to the next step, that is checking for chest rise and fall. Again, you check it for 5 to 10 seconds. How do you know 5 to 10 seconds are over? You count in your mouth or you count loudly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That means he's not breathing. That means you have confirmed that the patient is in cardiac arrest. Once you have confirmed that the patient is in cardiac arrest, you have to remember the steps of CPR. For remembering that, we do the thing is CAB, that is cab. You have to remember the word cab. CAB, where C is compression, A is airway, and B is breathing. Okay. So compressions, that means how much time will you do the compressions? How will you do compressions? How will you do compressions? So you locate this. Where is your heart? Your heart is not on the left hand side. Very important. Your heart is in the center. The bone that you can feel in between the two breasts, that the center is where your heart is lying. So you are going to compress on the center of the chest. How much time will you compress? It is, speed has to be 100 to 120 compressions a minute. In a minute, you are supposed to compress 100 to 120 times. Okay. But why 100 to 120? Because your normal heart rate is 72 beats per minute, but we don't have 72 beats. So I may be having 72, you may be having 84, someone else may be having 90, someone will be having 92, someone will be having 100. So different heart rate. Okay. So what is the ideal way to compress is, speed has to be 100 to 120. If you are alone and you're going to do both the thing, that is giving compressions and giving breaths, then you give 30 compressions, 2 breaths. 30 compressions, 2 breaths. 30 compressions, 2 breaths. This 30 is to 2, 5 cycles should get over in 2 minutes. You have how many minutes? You have only 4 minutes. First 2 minutes goes on checking for scene safety, checking for response, calling for help, checking for breathing. This will take away your 2 minutes. Next 2 minutes, 30 is to 2, 5 cycles. Okay. Will you stop at 30 is to 2? Or after 5 cycles? No. Because moment you stop, moment you lift your hand from the chest, patient is tuck, 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 that 4 minutes again starts. Okay. So this will keep on going till the ambulance come or till the medical person comes. You will keep on giving compression. You will not stop. That's why more and more people have to learn, because I alone cannot give it for 40 minutes, because ambulance in India will take at least 35 to 40 minutes to come. I cannot do it alone. Okay, so I need more people to learn about it. So I get tired, someone else gives CPR. He gets tired, someone else will give it. Even if we have 3 or 4 people, we can exchange our roles and keep on giving compressions till medical help comes. Okay, so compression How many of you feel that once we give CPR, that is compression and breathing, the patient will get up and tell you, thank you, sir, thank you, madam, you've done a good job? It will never happen. Because why I'm saying all this? Because in Hindi movies or in Bollywood movies, you have seen you press 2 or 3 times, the patient gets up and says, thank you, sir, thank you, madam. That will never happen in real life. Whether you give compressions for 2 minutes, you give compressions for 2 hours, you give compression, very good compressions for 2 days, patient is not going to get up. Then why should I learn about CPR when the patient is not going to get up? It is only to keep the brain ticking. With your compression, your heart can never start. So how will your heart start? Only when the patient reaches to the hospital. And you've seen that machine in movies, PPP, and then P. You see a straight line, that's a heart attack. That's a cardiac arrest. And then you give a shock to the person jerks a little, and again you can see the change in rhythm on the machine. P, 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 P. That means the heart has started again. So we need that machine to start the heart. It is not that easy that we can start the heart on the spot with compression. So why are we giving compression? Is not to start the heart. Be very clear. We are giving compressions or we are giving CPR is only to keep the brain alive, not to start the heart. Heart will start only once you use the shock machine to give the to shock the heart and start the heart. But till then, so reaching to the hospital or ambulance reaching to us will take some time. In that 4 minutes time, if the ambulance is not there or if that machine is not there, we might lose the person, or even if the heart starts and the brain is dead, the patient will be in the coma for the rest of it, which we don't want to. That's why you all are here to learn about CPR, because you can be the main role in reaching to the hospital, reaching to that machine and giving CPR and keeping the brain alive of the person till the person leaves. Now, when he reaches the hospital and he gets a shock, his brain is working, his heart has started, he can go walking and talking from the hospital. But if you have taken the person directly and you ask doctor, no, please help something, please do something, he is a very important person in my life, and doctor took the person and he gave CPR and he used shock, but even if the person remains alive, he'll be in the coma for the rest of his life. Okay, so you might see this. So you say, okay, heart may start. So heart can start even after an hour. Heart can start even after 2 hours. But what doesn't survive without oxygen and glucose is the brain, not the heart. Okay, but we have to, why there was no oxygen or circulation? Because the heart was not beating. So we are working like a heart and lung of the patient to keep this brain working, not the heart. Okay, so that is compression. So when you give compression, the speed has to be 100 to 120 compressions in a minute. If you're giving in ratio, that is 30:2. Okay, you should not be going very fast. So some people, when they learn, they feel, oh, it is very easy. Ma'am, you are saying 120, I can do better job than you. I can do 150. Or some people will be like, madam, I'm not able to reach 100. Can I do 70? Can I do 80? That doesn't solve the purpose. Because going too slow, the blood doesn't reaches to the brain, and going too fast, you're not allowing the heart to relax, and there are chances your patient will not survive. So you have to learn the right speed, that is 100 to 1. You can't go too fast, you can't go too slow, because either case your brain will not receive the circulation. Okay, so compression, push hard. And how would you know that the heart is getting compressed? How much should I compress the chest? Whatever pressure we have as per our pressure? No. It is, and the bone has to go 2 to 2.5 inches deep. Your bone has to press 2 to 2.5. If you're pressing only 1 inch, if you're pressing only 1.5 inch, that doesn't solve the person. So everybody, whether the person is thin, whether the person is obese, whether the person is very difficult to reach, for everybody, for the heart to press, I have to compress at least 2 to 2.5 inches deep. So we say, if you want to give good CPR, push hard, push fast. How hard? That is 2.5 inches. How fast? At the rate of 100 to 120 compressions per minute. But now when we start giving CPR, we feel, oh, very 100 to 120, this looks very difficult. So you go very fast, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. That is not the way the heart works. So you press, you let the chest come back. You press, you let the chest come back. You press, you let the chest come back to its original position. Once you have done that, then you give breath. Okay. So for giving breath, How do you open? So CAB, C is compression, A is airway. So we have to open the airway. How do I open? Why should I open the airway? Whenever the patient collapses, all their muscles relax. So your tongue is also a muscle, so it falls back. Now, for the tongue to be lifted up so that the airway opens, there's a technique. The technique is called head tilt chin lift. Can you see in the picture? Head tilt chin lift. This bony part is the chin. The soft tissue is not the chin. Soft tissue is the neck. So don't press on the neck. So head tilt chin lift. Once you have done that, then you give breathing either by a shield or a mask. So you give 2 breaths. With every breath, you would see your chest rise. So you take a deep breath, give deep breath, and then you take another, let the patient exhale, take another deep breath and give a breath. Okay, these are some of the devices that we use to give breath. So this is what we are talking about. So in adult, it is 100. So for everybody, whether it is an adult, child or an infant, the compression will be 100 to 120 compressions in a minute. Deep depth will be 6 centimeter, 5 centimeter, 4 centimeter, depending upon whether it's a child, infant or an adult. You should not be interrupting compression. As I told you, moment you interrupt the compression, 4 minutes time. Till the time you keep on giving CPR, the patient remains alive. You leave the CPR, the brain is going to die. Okay. So allow the chest to recoil. So for everybody, you will allow the chest to recoil. Okay. So what these are some of the steps of the CPR. Which first check for the scene safety. What do you mean by scene safety? You've learned the CPR and there's a fire around you. Would you enter into the scene to save somebody's life after putting your life at risk? No, I will not go into the scene because I am not trained for firefighting. But if the firefighters are around, they can help me to rescue the person and then I can give a CPR. Yes, I would definitely do it. So you have to check if there is a bomb blast around me. Would I enter into the area? Would I risk my life to enter into that area? No, I will not. If there's an accident on the road, I will first stop the traffic, take the person on the side, and then start giving. So check for scene safety is what we mean by that. Then check for response. Second step, how do you check for response? You tap on both the shoulders and ask, are you okay? Are you okay? If there is no response, you immediately call for help. So you shout, help, help, I need some help. If there are people around, you tell them to call an ambulance with an AED machine. AED machine is a machine which gives a shock to the patient. You tell, madam, you call, or sir, you call this particular number. So in India, in Bombay, we use 108 is the number. So you say call 108 and ask them to get an AED, please. And then you check for breathing. How do you check for breathing? You see for the chest rise and fall for around 5 to 10 seconds. If there is no breathing, no response, that means we have confirmed 2 steps of knowing that the patient is in cardiac arrest. Once this is done, then you immediately begin with the compressions. Okay. How many compressions? Speed has to be 100 to 120. Ratio would be 30 compressions, 2 breaths. 30 compressions, 2 breaths. Okay. Okay. So anything that you want to ask in theory before I move on to
I see some questions on the chat. Do you want to take those up
just a
before
minute.
you
Let's
demonstrate?
come to the screen first. Yeah. Okay. 1 minute. I'll go through all the questions and I'll answer one by one.
Yeah, I can recite the questions to you. You can pick them up. Will that help? Or you
Yeah.
want to take it up?
Uh, No, the machine that you're talking of is a ECG machine, PQR wave and QRS. We are not here to learn about ECG, so you're not going to. This is in response to Gautam sir. That is asked that machine blip is called the PQR wave, correct? No, that is not the machine that we're talking about. Okay? Nirvikar has asked question. Sometimes one is feeling pain in the middle of the chest, and if we give some compressions in middle part, after some time pain goes off. Shall we do this compression in case of pain, or it should be only given during cardiac arrest? So Nirvikar, has to be given only in cardiac arrest where the patient is not responding. So this what you're talking of, if there is any pain in the middle of the chest and the patient feels better, is probably something else, or it is a cardiac thing, or even if it is a cardiac thing, What I am talking about, compression requires a lot of pressure, and it will give you, anybody who's conscious will not be able to take that much of pressure. He will get severe pain in the chest. So anybody who's conscious, you're not going to do it. We're going to do only in two conditions: no response, no breathing. So here, when you're talking about the patient is having pain and you're rubbing and the patient is getting up, that means patient is conscious. So please do not try that on a conscious patient. Okay, Manoj has a question. You have heard that there are risk of rib cracking due to CPR. Yes, there are possibilities, because you are not the persons who are giving CPR are not always medicos. So they might be lay people, or that means for that matter, they are not a medical professional. So the hands placement may go little here. Patient may be under demineralized. So patient is old age, patient is a cancer patient. We don't know. When you press, you will hear cut, 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 cut. You will hear a lot of rib breaking. Still continue to give CPR. You have 12 on each side. That is 24 ribs. Break all 24, but keep the person alive. What is better? Dead person with intact rib cage in the for the funeral, or a person alive with a broken rib in the hospital. So that you have to decide. So you keep on. So do not think whether I should be giving CPR or I, because moment you think 4 minutes are over. So no thinking of it. Even if you hear kar 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 kur, keep on giving CPR. Okay. Um, that is to shoot videos will lead to loss of life. Should this be made accountable? Gautam sir, that is Dr. Gautam sir has asked. I'm asking a hypothetical question. The trend nowadays is to shoot videos which leads to loss of lives. Should this be made accountable under the law? I'm not the right person to comment about it, Gautam sir. When should I use AED? AED, if available around you, has to be used immediately in less, as quickly as possible, because AED is the one which is going to save the life, not the CPR. CPR, we are only buying time till the AED machine comes. So AED is the most important thing in the cycle of CPR. If you have someone, if you have an AED around in your office, in your so where in India would you find is on airports? There are around 200 AEDs in the aircraft, that is domestic and international, have mandatory AEDs. Their crew is trained for giving CPR and using AED. If an AED is available, earlier the better than the CPR. Okay. Choking a patient is unconscious, no pulse. So even if the patient is collapsed, you don't know when is the 4 minutes time. From the time you see, we assume it is a 4 minutes. So it is difficult to. So sometimes the incident may happen right in front of your eyes. You know, he was all good a second ago and now he is collapsed. Where you can predict it is less than 4 minutes. Sometimes you will enter into an area where the person is already collapsed. Okay, that time we assume from the time we have seen to be a 4 minute, and you give CPR in case you can save a life. Okay. There is one device named Sun. Is it? I have not heard about Namit. There is one device named Spandan. Is it really worth? I don't know. I think that device is for ECG, is not for the cardiac arrest. Is what I remember. I'm not really sure about that Spandan thing. Giving CPR. CPR is Praveen has asked, if there is no equipment or tool to give CPR, then should we give CPR by mouth to mouth? So we are giving CPR by hand. We are giving breath by mouth to mouth. Okay. Now, mouth to mouth looks glamorous only in movies and serials. But real life, it is not a very easy job, because a person is not. You may not be comfortable giving mouth to mouth. Person is not person is bleeding, person has vomited, person has not brushed his teeth. There's so many things you may not feel like giving bread to the patient. Another important thing why we say no to now to mouth to mouth is, suppose the person is an HIV, hepatitis B or hepatitis C positive. That is one. These are the diseases which once contracted, you will never become negative to it. And even if I have small cut, I have this habit of pinching my tongue, or yesterday when I was eating my food and I bit my tongue or something, there was a small cut. And when I give mouth to mouth and the person was bleeding, there are chances I may contract the disease. So for our own safety, we do not do mouth to mouth anymore until unless he or she is your near and dear one. Okay. Utsav has asked, how can one do compression and supply breathe simultaneously? I'll be showing you that, Utsav. what are the, Kishore Mishra sir has asked, what are the earlier signs of heart attack? Heart attack will give you a lot of signs, chest pain, difficulty in breathing and walking. I get tired very easily. Now I can't run. These are the signs of heart attack where you can get yourself evaluated by a medical professional. But in cardiac arrest, surprisingly, there is no sign. Person is all hale and hearty, and he suddenly our heart can stop beating any moment of time. That is why it is very difficult to reach the hospital. So cardiac arrest will not have any pre-existing signs and symptoms. Okay. Sovik has asked, and can you tell us something about blackouts and what to be done in that case? Maybe in next session, Sovik. Right now we are concentrating only on heart attack and cardiac arrest. Anup, if no breath and no reaction, how to know if the person is still alive, or should we still continue with CPR? If there's no breath and no reaction, that means patient is in cardiac arrest. You have to give CPR, Anup. Okay. Um, Gautam sir, thank you so much. Sir has written, after today's session, I'm going to spread awareness about the CPR 4-minute rule to sensitize people. Thank you so much, Gautam sir. Nipun, any medicine which should be in first aid box which can give in? No. Cardiac arrest is very sudden. By the time you realize the patient is already on the floor, and because he's not conscious, he's not going to assimilate any medicine. So you cannot give any medicine to patient with cardiac arrest. I'll be showing. Stella has asked, can you show the image of a performance? I'll be showing you that, Stella, in a few minutes. Adnan has asked, what causes cardiac arrest? Anything under the sky can give rise to cardiac arrest, for that matter. So you may be all hale and hearty and the heart stops. So we all are going to go leave this world with cardiac arrest, for that matter. It is only between you and us that 4 minutes time that we can save someone's life. Okay. So what causes cardiac arrest? Anything. So if you have bled a lot, you are dehydrated, you have got a sunstroke, you have got a electric shock, you have got a bad fracture, you have got a bad heart attack, you have got a bad stroke, you are a burn patient, anything under the sky can lead to cardiac arrest, and it is very, very sudden. Surprisingly, it is very, very sudden. Okay. And that's why you are the important key in saving somebody's life, rather more than the doctor and the nurses. Because by the time you reach to a doctor, it will be very, very late. Okay. Navjot is asking, can you reshare this 4-minute rule? Joined a bit late. Okay, Navjot, what I was saying is the CPR has to be big, has to start from the time the patient collapsed in less than 4 minutes time, because we are giving CPR not to start the heart but to keep the brain alive. And your brain survives without oxygen and glucose. Only can survive without oxygen and glucose only for 4 minutes. That's why that 4-minute rule is there, that we have to begin the CPR in less than 4 minutes time. You have no time to think whether I should do, whether I should not do. By the time you think, the patient is gone. So you have to be very quick in that. And that will happen only when you've learned CPR, then your response time will be less. Otherwise, you'll always be hesitant. Should I go? Should I not do? Will I do something good? Will I do something bad? Am I causing damage to the patient? So by the time you think all this is gone. So you have to be really, really quick. Can we use liquid droppers to continuously monitor and tank? If yes, what is the cost? I have Syed, I have no the, till now that robotic thing is not in the picture. And maybe in future we are looking out for something. That's what I've heard is CPR giving is itself a difficult job. So they might get a machine which will give a compression at the right rate. But for that again we'll have to call the people to get that compression machine. Souvik Shah is that, does sorbitate really work in case of these conditions? No, because the patient is in cardiac arrest. We are not talking about heart attack, Souvik, today. We are only talking about cardiac arrest and the patient is unconscious. So no medicines, nothing, no rubbing hand, no giving, keeping him warm will help him. How long the Sanjay sir has asked, how long the CPR should last? Till CPR would last till the medical help arrives or till the AED machine arrives. Okay. And CPR and AED machine goes hand in hand. You cannot do one. Okay, AED machine has come, or I have an AED machine. I need not learn about CPR. That doesn't happen. So everything will go hand in hand. That is CPR and AED machine will go hand in hand. Okay. Rajat sir has asked, could you recommend effective exercise that can be done at home or in the office, especially during working hours, that support heart health? You might undergo a lot of sessions about exercises, about food, about diet and everything, but will that is to prevent heart attack. That cannot prevent a cardiac arrest, very sadly. Okay. Manoj sir, will you the deck be shared after the session? That will be decided by the company HR. Dushyant Singh Rathod, if you come across someone lying unconscious on the floor in a public place, how can you understand whether it's a cardiac arrest or simply unconscious? That is what we are going to learn. That is tapping on both the shoulders. So a simple unconscious person may not respond, but he will always be breathing. Whereas in cardiac arrest, it will be both no response and no breathing. That is how you will distinguish between unconscious patient and cardiac arrest patient. Okay. Okay. Any more questions? Should we demonstrate? Should we start the practical thing so that it will be more clear to you?
Sure, doctor.
Abhishek sir, do we need to do CPR with AED machine? Yes, this goes hand in hand. If you have an access to AED machine, it will go hand in hand. Okay. Just give me 2 minutes. I'll adjust the video so that you all can see effectively. Can you all see the mannequin?
Yes, doctor.
Great. Which is more clear now? This is more clear?
Yeah, this is much better.
Yeah.
Yes.
Okay. So what was the first thing that I told you when we are giving CPR is check for scene safety. So you check whether the scene is safe or not. Once you have confirmed that the scene is safe and this person is lying on the road or wherever, in the house, on the road, in the office, then you first call, hello, hello, sir. Sir is not responding. So no Indian technique of checking with response with the leg, with sprinkling water, pinching on the eyes, pinching in the ear, nothing doing. You directly tap on the shoulder. Are you okay? Are you okay? He's not responding. Okay. So next step, I cannot do anything alone. So I call for help. Help, help, help. If someone comes, I say call 108 and ask them to get an AED machine. Okay. Then you check for breathing. So how do you check for breathing? You look at the chest. Okay. We no longer do hearing from the nose or putting our ears onto the ear. Now what we do is we look at the chest. So how do I look at the chest? I go near to the chest and look whether it is, I can see rise and fall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. He's not responding. He's not breathing. Okay. Now what we do, we give compressions. So where, so you have to locate the heart. Okay. How will you locate the position of the heart? You all go from your abdomen and feel for this bone. Can you feel this bone? Okay, from there, 4 fingers up is the location of your heart. Okay, what you do is you put the heel of the hand, don't put the entire hand, put the heel of the hand, lock it, and come on the patient. So you are not going to compress with your hand. No bending at the wrist joint, elbow joint, and the shoulder joint. Your entire body weight will go down when you are pressing from the hip joint. You're going to press. It is not very easy to push for 2.5 inches. You have to be really, really strong. So you are going to put the entire body weight on the patient. So you put the heel of the hand, lock it, come on the patient, make your hand absolutely straight and tight, and then you give compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. This is the speed of giving 30. Don't do it like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 10. I have not asked you to go at high speed. Go at the right speed. That is 1, 2, 3, 4. This is a good enough speed to give compressions and to start the heart. Okay. Then we give breathing. So I have to, for giving breath, I have to open the airway. This is called head tilt, chin lift. Okay. If I, since mouth to mouth is now stopped, and suppose you don't have a pocket mask, then what you do is you keep on giving compression. So after 30, I might not stop. 30, 1, 2, 3, 4, 5, 6, 28, 29, 31, 2, 3, 4. So I will keep on giving compression. That is called hands only CPR. If I don't have access to pocket mask. If I have an access to pocket mask, this is called pocket mask. Okay. So what do is, this is a pocket mask. You pop it into shape. This is triangular in shape because your face is very triangular. So you put the narrow portion goes to the nose and the broad portion goes in between the lower lip and the chin. Okay. So you put it here. Okay. Make a tight seal and you give 2 breaths. So you do head till chin lip, place the mask and you give 2 breaths. And then you keep the mask down and come back to the chest and give compressions. 1, 2, 3, 28, 29, 30. Again, I lift the mask, put it on the face, give some breath. Again, come back to the chest and give compression. 1, 2, 3, 4, 28, 29, 30. So this you keep on doing till the medical help or the AED machine arrives. Okay. Did you get what? How does the compression looks like? How does the CPR looks like? Is that clear? What? How does an compression and CPR would look when you give CPR? Any doubt in CPR? Yes, yes, yes. Now you understood how compressions and breathing goes hand in hand. So give 30 compressions, give 2 breaths. Give 30 compressions, give 2 breaths. Okay. AED machine, Priyam. AED machine is a machine which gives a shock to the heart. So it's a small machine which is designed to be used by the people who are not a medical professional. So people like you, so people abroad, what happens whenever there is more, wherever there is more than 200 people, like office, schools, college, malls, it is mandatory. In India, we don't have AED around us, so we find AEDs only in airports, and some of the MNCs has it, like DHL has it, PNG has it, HPCL, government institutes like HPCL, BPCL has it. So these are the places which has got AED. If you have an AED and you call for an AED, it is a very simple thing to use. You have 4 basic steps. You on the machine, you connect the pads, and machine decides on its own whether to give shock or not. If the shock has to be given, you just have to press the red button to give shock, and the patient gets a shock. So you can take a live person to the hospital. So you are not waiting for the ambulance to get us the machine to shock. It may be delayed by 30 minutes, 45 minutes. But if we have an access to an AED around us, we can start the heart more faster. Navjot, the heel of the hand, yeah, exactly near the middle. So what this is what I was talking about. So this is the middle, this is the bone. From there, 4 fingers, there I'll put the heel of the hand and lock it. Okay. So that is the exact position you're going to place your hand. So they tell you on Google or internet, they'll say in the middle of the chest. But for middle of the chest, you have to have the exact, perfect body, which we all don't have. Okay. So that's why I've told you the exact way to locate the heart is you go from your bone. So you go from the chest bone, you feel for the bone. So this is how you do it. You go from your abdomen, 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 you feel for the bone. In that abdomen, 4 fingers up, that's the position of your heart. Okay. Only question is you keep on alternating. It has to be in less than 10 seconds, Gautam sir. Alternating between breath and compression has to be in less than 10 seconds. Sometimes when you give breath, you might not see a chest rise. Probably you have not opened the airway properly. That is, you have not done the head till chin lift, or the patient is choking and you didn't know the patient is choking, and you will not see a chest rise when you give a breath. Leave the patient and go back to compression because compression is very, very important, more important than breathing. Manoj sir, if a pocket mask is not available, we will advise not to give you mouth to mouth. Then you give only hands only CPR. That you keep on giving compression and do not stop it until unless you are tired and somebody else takes from it. Because as I told you, there are chances of cross infection. That is like HIV, hepatitis B, hepatitis C. So to protect ourselves, I will advise you not to give mouth to mouth. Even if then you keep a handkerchief, the fluid will pass through it. Okay. Uh, Shubham Singh, is there any body movement? No, there will be no body movement. It is very, very sudden. Patient stops suddenly, patient falls suddenly, and you will have no time to think rather than just giving CPR. Gautam sir, yes, AED machines are found in some now. It is mandatory for airports to keep it. So there are about 200 in Mumbai airports, and defibrillators. AED and defibrillator is same one and the same thing. AED is a compact one, and defibrillator is what we see in the hospitals. Sir. So AEDs are available in Mumbai airport, about 200. It is mandatory for domestic and international aircraft to have it. So they have it. Uh, Abhishek sir, yes, we need to give CPR till the AED machine arrive, and after AED machine arrive, once you have given shock, again begin with the steps of CPR till the person gets up and tell you, sir, thank you very much, you have saved my life. So with AED machine, chances is that the patient may get up and tell you, sir, you, or madam, you've saved my life. But with only CPR, patient will never get up. What steps to be taken in addition to giving CPR? No other step to be taken. You have to keep on giving CPR till an ambulance comes. You can do nothing else for the patient in that moment of time. Medical AED machine is not available in medical shop. It's a costly machine. It costs around 1.5 to 2 lakhs. There are different companies who makes it like Philips, Lardell, BPL, L&T. They make it, and it is available on their sites. The machine is available on sites. It can be. It has a battery life. So that machine works on a battery life. So they might have a 3 years life or a 150 shocks, whichever is first. You will have to replace the battery. It doesn't need a charging or something. It's a compact machine. You can run with that machine from one place to another. It's a very small, like a Tupperware tiffin box, very small. Breathing, we just have to push the breathe. You are taking a deep breath and you breathe out. You have to breathe in, and when you're giving breath to the patient, you're breathing out in the patient's mouth. That is how you give breath to a patient. Yes, Gautam sir, I do conduct this programs for people outside corporates too. If the ambulance is delayed, you can take the patient by your car, but it is very difficult to sit in that kneeling position and give CPR when the car is moving, actually, Pavitra. So it is very, really difficult until unless it's a, very, and because the patient has to be lying on the flat ground, and with the car seat will be cushioned, so you will not be able to reach to the height of the patient. To give CPR. So it is not advisable to give CPR while moving or something in the car. It is advisable for you to wait for the ambulance to come. You cannot give any injection or something to the patient while doing CPR. As such, even the doctor will give CPR, give injections only once the patient become conscious after evaluating what led to CPR, what led to cardiac arrest. So it is not always heart attack which will lead to a cardiac arrest. There can be, as I told you, there can be so many things which can lead to cardiac arrest. For example, if there is excessive bleeding, blood loss can lead to cardiac arrest. So I will have to transfuse the blood. If it is dehydration which is called a cardiac arrest, I will have to infuse the fluid. If it is an electric shock, then I will have to see what has been damaged and accordingly give. If it is a heart attack, I will have to treat the heart attack and then give that. So there is no particular injection to give in case of CPR. Gautam sir, I expect too that people give more importance to the first aid and CPR rather than taking out videos. Deepak Sharma sir, thank you so much. I hope you enjoyed the session. Any more questions? Any more questions? Did you all enjoy the session? How do we know the person is dead? So cardiac arrest is like a Sayyad is like a dead situation. We all are going, as I told you, we all are going to when the doctor declares dead, when the person is in cardiac arrest and you see a straight line. So when you're giving CPR, suppose you have to give CPR for a long time, sometimes you might realize the patient is absolutely not responding. Or even if you're using AED machine, the machine will keep on saying no shock, no shock, no shock. Probably the patient is that scenario, you cannot declare someone as dead because you are not a medical professional. Wait for the ambulance and keep on giving CPR till the, even if you feel the patient is dead, because you don't know what miracle can happen any time of life. And only medical person are authorized to claim to declare someone as dead. So please, even if you realize that the person is dead, please do not declare it there. Otherwise, the people will panic and beat you left, right, and crash you. Okay, I can see good reviews. I'm sure you all enjoyed. Thank you very much. I enjoyed conducting it too. And any more questions, you can always drop in, and I'll be able to answer. Thank you. Thank you so much.
Thank you so much, doctor. Thank you, everyone. Requesting everyone to kindly fill out the feedback form. It also has a question if you're an HR and you would like to conduct an offline session on the CPR training, we could also help you do that. So please take out like a minute of your time, fill out the feedback form. It will help us improve and help us serve you with more options. Thank you so much, Dr. Shilpa. Very, very helpful.
Thank you. Thank you so much, Kinaksha, to give me this opportunity to train people. Thank you so much.
Yeah.
Thank you.